So how was your weekend?
It was really good. Had a great time and did a lot of good things. How about you?
Everything went really well.
Great.
Perfect. Well, thanks for finally coming in. I know we talked about having a
I
session
know.
with you here in the office. I know you're here to get a regular eye exam, which is definitely something that we recommend for all adult patients to come in.
Mm-hmm.
I think with most commonly when people think about an eye exam, they think about getting glasses or some contact
Right.
lenses. But there's other key parts of this exam that we do more of the medical part to make sure your eyes are otherwise doing healthy.
Okay.
Some of the things that we look for commonly would be cataracts, glaucoma, macular degeneration. There's a whole bunch of certain diseases that we look at that we may be able to notice first in your eye before you actually have symptoms, and that's the best time to take care of them.
Yeah.
I know many of my other colleagues here in the group come over and we do interviews with you guys at the station. We all talk about different diseases. This is a culmination of putting all that together to make sure your eye health is okay.
Fantastic.
I know you had a
Great.
chance to meet our excellent technician,
Yeah.
Amanda. She's
Good
been
to
working.
see you.
Good to see you.
She's been working with you before. So just to kind of go over some of the things that she's done. She brought
Okay.
you into the room. She had a chance to check your vision. Also had a chance to do some baseline tests, allowing to see how your pupils are doing, check your visual fields. We also had a chance to look to see what, if any, pair of glasses may be able to help. And it sounds like you're having some issues with seeing far away.
Right. I mean, I've used reading glasses starting maybe 15, 20 years ago. And of course, they progressed to, I think I have a 2.5. But what I'm noticing now, especially looking across the room, an example I gave to Amanda was going to watch my daughter play basketball in the gym. Of course, nowadays they use more low-level, energy-efficient lighting, and it always looks like I'm trying to see across and perfectly. I can't read the the countdown clock or the score very well. So
Sure. As long as they're winning, it's okay.
they're doing a good job. Yes,
But
they are.
not uncommon what you were saying, how at first, especially the reading, the strength
Right.
gets stronger as you get older. That's a condition called presbyopia. Basically, it's a stiffening of the natural lens. Back when we were young, the lens is able to flex, so it's able to see far away and then flex to see up close. As we all naturally age, especially when we hit about 40 years or so,
Right.
it gets more and more stiff, so you require a pair of reading glasses, and eventually that strength becomes stronger and stronger. That's a normal progression that we see. Your difficulty seeing at distance sometimes can be a sign of other issues going on, possibly cataracts going on, which is something we'll definitely take a look at. And
Okay.
sometimes it's just a pair of glasses that you need.
Okay.
I know in other parts of the exam that Amanda had to do, she took you over to another room, got
Right.
some testing done to see what the prescription would be roughly be, and then we brought you back in here and we checked for that. We also did some special pictures of the back part of the eye, looking for other diseases, as we talked about glaucoma and macular degeneration.
Okay.
Those would be very sensitive pictures of the back part of the eye to see if there's certain things that we could see or not see. You'll be surprised, the level of detail we're looking at is so fine that sometimes it's easy to miss even on our exams because we're talking about small things on the level of microns.
Wow.
So the technology really in ophthalmology, we call them all of our cool new toys that we
Yeah.
have, has significantly improved us seeing things that we normally wouldn't be able to see. So we use that extra testing to complement what it is we do in our exam.
And that was the imaging that I did over there.
That's
Okay.
correct, yeah. So harmless, just a bunch of toys that we
Yeah.
don't have a chance
They're
to look
very
at
nice
your eyes.
toys.
Well, now we have all that information together. Let's go ahead and take a look at your eyes, see how you're doing.
Okay.
And then we'll kind of put it together. Certainly, if you have questions while we're examining you, you just feel free to let me know.
Okay.
Great. Well, what I'm going to ask you to do here is just look straight ahead here for me. I'm going to shine the light and move the light around in a couple of different positions. Just to have a good view of your eyes. All right, what I'm going to ask you to do is go ahead and look up for me. And then down to the ground. The first thing that we do here is we start from an approach looking at the outside of the eye and then looking towards the inside of the eye. Look straight ahead. So we all have a very systematic way of doing things. So in this case, we're just looking at the eyelids first and looking underneath the eyelids. Make sure we're not missing anything there. Then the next thing that we do is we start off here on the outer sections of the eye or the whites of the eye. Take a look around to make sure there's no signs of any allergies or any possible infection. And then we start focusing in really on the center part of the eye. The first part of the eye is the cornea. It's that clear window of the eye that you look through, the windshield of the car would be another way of putting at it. Sometimes people can have diseases in the front part of the eye, such as keratoconus. The next thing that we do here is we continue to look backwards. So we look at the color part of the eye, the iris. Make sure it's nice and normal looking. And then just through the pupil of the eye where we look through, we actually see your lens. And lens is what naturally becomes a cataract as you get older. Then I'll have you look up here again, and we'll repeat the exact same process here in the left eye. Look down to the ground. And then straight ahead here for me. Sometimes certain diseases pop up only in one eye and not in the other, which is why it's important for us to take a look at both eyes. And by convention, we always start in the right eye. Now, if you don't mind here, I have Amanda working here to my left, so I may whisper a few things. She's just jotting down some notes for me, so don't be too startled with that. Well, the front part of the eye looks nice and healthy. What I'm going to go ahead and do is take a look towards the back part of the eye. So I'll have you blink for me a few times. Now, the eye, I don't know if you know this, Ken, is one of the only places in the body where we can actually see the blood vessel and the nerve on the inside. Imagine if we wanted to look at your kidney, I couldn't actually look at it. You would need to have surgery to do that. Well, the eye is very unique in that if we focus the light the right way and use some of our special lenses, I can actually see the nerve of your eye and your blood vessels.
Wow.
And this may sometimes be the first time people notice they have high blood pressure or diabetes or other diseases that they may not even know about. What I'm going to have you do is look straight ahead here for me. So what we do is we shine this light straight through the pupil, and then using this lens, we have a chance to look here in the back part of the eye to where the optic nerve is, the cable line connecting the eye to the brain, and looking at your blood vessels. The other important parts that we look at here is the macula, which is what we consider the high-priced real estate. That's the part that gives you the good vision right in the middle, and that's also the area where macular degeneration affects you. So Amanda has a very nice cup-to-disc ratio, 0.4 with healthy nerves. So what I'm referring to that is we're looking to make sure you don't have any signs of glaucoma or macular degeneration. I'll have you look straight ahead again here for me. Sometimes people will say when we're shining this bright light in there, they can actually see shadows or their blood vessels back there. So that's not an uncommon thing to see. I usually tell them that's a good sign if they see that. And then we take a look around, make sure everything looks good. Similar cup to this. So the left and the right eye look about the same. What I'm going to have you do is go ahead and sit back for me here. I'd like to check your pressure. Now, before I do that, I'm going to put some eye drops in to make sure your eyes are nice and comfortable.
All right.
And then we'll go from there.
Now, were those lenses, did I look at that you had, were they colored?
No, they're not colored.
Oh,
okay. That's your blood vessel. That
okay.
Yeah. The lenses come in many different shapes and sizes depending on what kind of exam we do. One of the specialty lenses that we have for glaucoma exam is when we're looking at the drainage system of the eye. It has a bunch of mirrors on it. And the reason why you need to have mirrors is it's one of the few places in the eye where if you look at it directly, you can't see it. It's the optics or the physics of the eye. The mirrors help me take a look inside. So this is just to check your pressure, so lasts just a few minutes, has a little bit of a green tint to it. I'll have you look up for me. So all we need is just a little bit in there, and you can go ahead and wipe off the excess. These medications work pretty quickly. The numbing drops, they take about 10 seconds or so for them to work.
That is green.
It really is green.
Do I look Vulcan?
Well, we want you to look good when you're done.
Yes.
Unlike the other drops that we normally put in your eye to dilate your eyes, those dilating drops take about 15-20 minutes to kick in, and they can take several hours for them to work too. Yeah. So I'll have you come on forward here for me. Again, we want to make sure you're comfortable.
Okay.
All right. Have you look straight ahead.
Good. There we go.
And then when we put that eye drop in, it has a little bit of a greenish hue to it. So it just fluoresces. It's kind of like being in a dark room when you shine this blue light. So if there's anything abnormal to the eye, it'll actually give it a little bit of a green stain. So when people come in with like a little paper cut or a corneal abrasion to the eye, it'll actually stain that area and tell us where the problem is for us to take a look at. And in this case, when we're looking at the front parts of your eye, everything looks great, nice and smooth. If you had a corneal abrasion, you would definitely feel it. The next part of this, I'm going to shine this extra blue light here, and I'll have you look straight ahead. And this is what helps us check your eye pressure. Great, you're doing wonderfully. Your eye pressure is good in that eye. Go ahead and take a look over here. Outstanding. Good. Go ahead and sit back here for me. Pressures are also doing really well, 14 in both eyes.
So what are you actually looking at for pressure? Are you looking at the size of the blood vessels back there?
So when we're checking you for pressure, really we're checking you for glaucoma. So there's many different things that we look at. One of them would be checking your eye pressure just as we did. The eye pressure is really the only thing that we can bring down to help with glaucoma.
Mm-hmm.
But glaucoma is a disease where you have to put several different pieces of a puzzle together.
Okay.
Pressure is just one of them. We're also looking at the nerve in the back of the eye, and usually I describe that as a donut with a little donut hole
Right.
to make sure the donut has a healthy appearance. Part of that was some of the work Amanda did with you already, asking you if there's a family history of glaucoma or other medical diseases,
Mm-hmm.
and the scanning test she did with you to make sure the nerve thickness looks okay.
Okay.
I had a chance to review all of those different tests and measurements. Your medical health is otherwise doing really well. Very happy with that. I think the biggest issue we have here is just an update in your glasses, or in particular, a pair of glasses to help you see far away would work out for you.
All right.
There's a couple
Very
of different
good.
things we can do with that. There's bifocal glasses or trifocals or
Mhm.
progressive glasses. They're all just different types of glasses that you can get. Some work better for others that we can get situated later on. But
All
otherwise,
right.
very healthy.
Fantastic.
I always end with making sure you see if you have any questions, anything in particular we can talk about.
No, I think you and Amanda really answered all my questions.
Right.
And, it's a very easy procedure. The main question I have for you is, at what age should people come in and is it yearly, every 6 months, to have just a general eye exam if they don't really have much family history of any problems?
Certainly, if there's no family history and they're otherwise doing okay, haven't had any trouble with school, when you're about 18 years or so, you should probably have an eye exam done.
Okay.
Generally, when you're younger, it's not necessary to come in every year, but as you get older, you want to be seen more frequently.
Okay.
Because as you get older, some of these medical diseases become more common. But there are other cases where people do have family histories
Mhm.
that they need to be seen earlier. I deal primarily with glaucoma. We have babies or kids with glaucoma. So it really depends on what's going on. But for an otherwise healthy person, at least when you're 18, you should have it checked. Certainly if you're having any symptoms, you should
Mhm.
come in and get things checked. And I think Amanda went through a list of questions here with you too.
Right. Yes, she did.
Yeah. So as you get older, more frequently, but when you're younger, once every few years. And as you get older, pretty much consistently. You should be seen every year.
All right. Very good. And, we've talked about this before, along with the many of the other doctors that have been on. I'm a big person of wearing sunglasses all the time and doing what I can to at least protect my eyes.
Yeah.
So try and wear protection if I'm working on something or whatever it may be. And I know you have emphasized that over the years.
That's the best thing you can do. It helps prevent certain diseases.
Yeah.
Definitely the way to go.
Yeah,
Well, great.
definitely.
Well, thank you so much for coming in. Appreciate
Yes,
having you
thank
here. Make
you.
sure you keep your appointment for next year.
I will. Always good to see you. Amanda, thank you very
Thank
much.
you.
It's been a pleasure.
It's nice meeting you.
Nice meeting you.
Great. Thank you.